Sarah.
Okay. Our subject today is anatomy of vertebral column, joint, and ligament. Concept of vertebral column, segmentation. The vertebral column, also called the spine, spinal column, or backbone, composed of series of bones called the vertebra, has 33 vertebrae, 7 cervical vertebra, 12 thoracic, 5 lumbar, 5 sacral, and 4 coccygeal. Also, we have 2 types of curvature, a primary that involve the thoracic and sacral region, and the secondary involve the cervical and lumbar region. So the term late curvature, L for lumbar and C for cervical. So late curvature are cervical and lumbar vertebra. We have abnormal to talk about abnormal spinal curvature. This is the first picture involve the normal curvature of vertebral column. The second picture involve the kyphosis, which means back curve of a vertebral column. Third picture, lordosis, which means forward curve of vertebral column. And the fourth picture, scoliosis, which means sideways curve of vertebral column. In case of scoliosis, we should measure the Cobb angle to know the progression of scoliosis. So this is the method of Cobb of angle measurement. We will identify the upper tilted vertebra. This is the upper tilted vertebra, and this is the most lower tilted vertebra, and draw the line along the vertebral end plate and identify the Cobb angle. As in this case of thoracic scoliosis, this is the upper tilted vertebra, and this is the most lower tilted vertebra, and this is the Cobb angle. Mild scoliosis range from 10 to 20, and the moderate from 25 to 45, and severe scoliosis above 45. Typical vertebra. The typical vertebra consists of body and vertebral arch. This is the vertebral body. The vertebral body, it is the most anterior cylindrical portion. As we see, it is roughed superiorly and inferiorly to give attachment with the intervertebral disc. And this is the pedicle. It is a project from the posterolateral aspect of the vertebral body. This is the posterolateral aspect of the vertebral body. So the site of the projection of pedicle. The pedicle have a superior curve. This is the superior curve. This is another superior curve with the adjacent vertebra to form the intervertebral foramen. Also, we have the lamina. Also, it is a bilateral plate that it is fused to form the spinous process. So we have 2 transverse process. The transverse process formed by a fusion of pedicle and lamina, while the spinous process formed by fusion of 2 lamina. Also, we have superior articular process facet to form the superior articular joint, and inferior articular facet to form the inferior articular joint. This is the vertebral body. This is pedicle bilaterally project from the posterolateral aspect of vertebral body. And this is the transverse process by fusion of pedicle and lamina. This is the lamina. And this is the spinous process. This is the X-ray, this is lateral view, and this is the anterior view. This is the vertebral body. The more dense the end plate, vertebral end plate, upper and lower vertebral end plate. And this is the intervertebral disc. This is the pedicle that it is a project from the posterolateral. This is the posterolateral aspect of the vertebra. So this is the site of pedicle. Pedicle on the AB view look like the eye on each side of the vertebral body. This is the spinous process. And this is the transverse process. The pedicle, this is represented by green color. This is from the posterolateral aspect of the vertebral body. And this is, as we talk, this is the curve, superior curve of vertebral of pedicle to form the intervertebral foramen. This is the site of the intervertebral foramen through which the spinal nerve root will pass. So the spinal nerve root is seen above the pedicle and not below the pedicle. This is the lamina represented by purple color that it is fused together to form the spinous process. We talk about the typical cervical vertebra that it is from the C3 to the C6. There are some characteristic feature of the typical cervical vertebra. This is the most important one is the transverse process. This is the transverse process formed by fusion of pedicle and lamina. It is have a foramen transversarium for transmission of the vertebral artery that it is passed from the C6 and above. It is not transmitted through the C7 vertebra. The vertebral canal triangular in shape and the spinous process buffet that it is more characteristic for the cervical vertebra. This is the transverse process and this is the bilateral view. This is the anterior tubercle of the transverse process and this is the posterior tubercle. The atlas, C1. This is atlas vertebra. It is a ring shape. As you see, this is a ring shape. It has no body. It is the only vertebra that has no body. Composed of lateral mass. This is a lateral mass of the C1 vertebra connected by two arches. This is the anterior arch and this is the posterior arch. In the anterior arch, there is a tubercle, so it is called anterior tubercle. And this is the posterior tubercle within the posterior arch called the posterior tubercle. The lateral mass have a superior articular surface and inferior articular surface. Also, as with other cervical vertebra, have a transverse vertebra with a foramen transversarium. Also, it is have a groove on the superior aspect. This is the superior aspect. Have a groove for the vertebral artery as it is assigned to the foramen magnum. This is the 3D CT. This is the anterior tubercle. This is the transverse process. This is the foramen transversarium, and this is the groove. This is another groove for the transmission of the vertebral artery. The axis, C2. C2 vertebra, this is this part called the odontoid process, represent the body of C1 vertebra. It is not carrying a weight as the C1 vertebra, but have a lateral mass. This is a lateral mass of the C2 vertebra. It is usually large. This is carry the most of the weight of the skull and it transit it to another part of the vertebral column. The odontoid process have anterior part called the anterior articular facet for articulation with the anterior arch of the C1 and have posterior articular facet for articulation with the ligament with atlas. This is the lateral mass, superior articular surface on each side, and this is the transverse process with the foramen transversarium, and this is the typical of the cervical vertebra. This is the spinous process that it is buffet in shape. This is open mouth view. Show this is the C1 vertebra. This is the C1 vertebra, and this is the C2 vertebra with odontoid project within the C1. So this is the lateral mass of the C1, and this is the lateral mass of the C2 vertebra. The C7 vertebra characterized by long spinous process. It is the only vertebra of the cervical spine that not have a perfect spinous process, with the foramen transversarium small and carrying only the vertebral vein. It does not carry the vertebral artery. The joint of cervical spine. This is Atlanto occipital joint. This is the foramen magnum. This is the skull. This is a foramen magnum. On each side, called the occipital condyle, together with atlas to form the Atlanto occipital joint. This is Atlanto occipital joint on each side. That it is responsible for flexion, extension, and some lateral motion. Another three joint make the Atlanto axial joint. This is a joint present between the odontoid process and the posterior aspect of the anterior arch. This is the anterior arch of the C1. This is the odontoid. So it is called Atlanto axial joint. This distance usually 3 mm in adult and 5 mm in children. Another joint is the synovial joint present between the two lateral mass of the C1 and C2 vertebra. The neurocentral joint of Loschka, this is the neurocentral joint of Loschka. This is the vertebral body. On the posterior lateral aspect, this is the posterior lateral aspect of the vertebral body called the uncinate process. With the adjacent vertebra, this is another uncinate process. With the adjacent vertebra form the joint of Loschka. It is not a true synovial joint, often called so. The alignment of the cervical spine in respect to the foramen magnum should be assessed by three radiographical imaginary lines. The first line called the Chamberlain line, the second McGregor line, and the third Digastric line. The first one, the Chamberlain line, this is extend from the posterior aspect of the hard palate. This is the palate, this is the hard palate, and this is the soft palate. This is the posterior aspect of hard palate, and this is the posterior lip of foramen magnum. This is the foramen magnum. This is anterior aspect, and this is the posterior aspect called obstruent. So the Chamberlain line extend from the posterior aspect of the hard palate to the posterior aspect of the foramen magnum obstruent, and the dense odontoid process should not be more than 2 mm above this line. While the McGregor line extend from the posterior aspect of the hard palate to the occipital region, the base of the occipital region. So the odontoid should not be more than 5 mm above this line. The digastric line, this is the mastoid on each side, and this is the digastric notch. So this line, they join the digastric notch called the digastric line. This is the Atlanto axial joint. In this case, the Atlanto axial joint should be below this line, should be below this line. This is the computed tomography show. This is the Atlanto occipital joint. This is the foramen magnum. And this is bilateral occipital condyle. So this is Atlanto occipital joint. And this is Atlanto axial joint. And this is the sagittal view show. This is the anterior arch of the C1. And this is the dense. This is the anterior limb of the foramen magnum called fascion. And this is the posterior border called obstruent. This is the cervical vertebra. This is the vertebral body located anteriorly. This is the pedicle from the posterolateral aspect of the vertebral body. This is the lamina forming the posterior wall of the spinal canal. And this is the foramen transversarium that transmits the vertebral artery. And this is the spinal process. This is MRI Sagittal show. This is the spinal cord. This is the CSF. This is the vertebra, and this is the intervertebral joint between the two vertebrae by intervertebral disc. And this is the axial show. This is the vertebra. This is the vertebral body. Bilaterally transverse process with the vertebral artery. This is a vertebral artery. There is some abnormal radiological finding in the cervical region. As we see, this is the bilateral cervical rib that occur in the 7%. This is a project from the C7 vertebra. This is a bilateral cervical rib. This is the C1. This is the CT scan show. This is the C1 vertebra that it is a ring shape. This is a fracture on the anterior arch. This is the anterior arch, as we mentioned, and this is the posterior arch. So there is a fracture in the anterior arch and in the posterior arch. This is called the Jefferson fracture. Thoracic vertebra. These have articular facet on the lateral aspect of the vertebral body for articulation with the rib. The articular facet are also found on the anterior surface of the transverse process. Its spinous process are long and slope downward. To see, this is the thoracic vertebra. In additional to the feature above, there is additional facet process. This is the lateral aspect of the vertebral body. So there is a superior. This is called superior costal facet for articulation with the rib to form the costovertebral joint. And this is another articular facet in the anterior aspect. This is the transverse process. This is the anterior aspect of the transverse process. There is a costal facet for articulation with the rib, also to form the costotransverse joint. As we mentioned, the spinous process usually long and slope downward. Joint of thoracic region, we have a costovertebral, as we mentioned, and costotransverse, and intervertebral and facet joint. This is the lateral X-ray show. This is intervertebral joint. This is the vertebral body with end plate, upper end plate, and lower vertebral end plate. And this is the disc space. This is the side of the pedicle from the posterior lateral aspect. And this is the intervertebral disc. By computed CT scan, this is the vertebral body. This is the inferior articular process of the vertebra, and this is the inferior articular process, and this is the superior articular process.
دكتورة رشا صوت مالكو راح.
Computed. This is computed tomography of thoracic spine. This is the inferior articular process of the vertebra above, and this is the superior articular process of the vertebra below. The inferior articular process should located posteriorly, and the superior articular process should located anteriorly. بس دقيقة. Okay. And in this axial view, this is the transverse process, and this is the costotransverse joint. This is the rib, and this is the transverse process of the thoracic vertebra. So this is the costotransverse joint, and this is the costovertebral joint. MRI of thoracic spine. This is the vertebral body, and this is the costovertebral joint between the rib and the of the vertebral body, and this is the costotransverse joint between the rib and the transverse process. The lumbar vertebra. The lumbar vertebra have a large anterior vertebral body, and the bilateral pedicle project from the posterior lateral of the vertebral body to form with the lamina to form the spinous process that it is spatulated. This is the transverse process that it is spatulated. The spinous process formed by fusion of two lamina on each side. It is usually strong and square and located horizontally. With the exception of the L5, this is the L5 vertebra, in which the transverse process project from the lateral aspect of the vertebral body and pedicle, and not by a fusion of the pedicle and lamina. Joint of lumbar region. There is intervertebral disc space. This is the intervertebral disc space between the two vertebral body and the facet joint. This is the facet joint. This is the axial view. So this is the vertebral body located anteriorly. This process that it is located anteriorly, it is of the superior articular process of the vertebra below, and that it is located posteriorly, it is of inferior articular process of the vertebra above. By radiography, This is the vertebral body, and this is the intervertebral disc. This is the intervertebral joint space, and this is the facet joint. This is the superior articular process, and this is the inferior articular process to form the facet joint. And this is the strong square spinous process. As we descend, the vertebral body will increase in size, and also the transverse process that it is spatulated. As you see, it is increase in size as we descend downward. By CT scan, this is the vertebral body, this is the facet joint, and this is the spinous process. And this is the site of the left intervertebral foramen for passage of the spinal nerve root. This is the axial view, show the vertebral body. This is the intervertebral disc space, and this is the facet joint. By MRI, this is the vertebral body. This is the intervertebral disc space, and this is the spine. Between them, this is the interspinous ligament. And this is the MRI2. This is the vertebral body, and this is the intervertebral disc space. The sacrum. The sacrum is composed of 5 fused vertebrae. It is triangular in shape and concave anteriorly. A central mass is formed on the pelvic surface by fused vertebral body. The superior border of a central mass is the most anterior part of sacrum, and it is called the sacral promontory. 4 anterior sacral foramen on each side transmit the sacral anterior primary rami. Lateral to these is the lateral mass of the sacrum, the upper anterior surface of which is called the ella of sacrum. This is the sacral bone. It is triangular in shape, as you see, composed of a fusion of 5 vertebrae. This is the site of fusion to form the central mass. The superior part of the central mass is called the sacral promontory. This is the central mass. Lateral to the central mass, there are 4 pair of foramina that it transmit the sacral anterior primary rami. Lateral to it, this is the ella of sacrum. From the posterior aspect, this is the site of the fusion of the spinous process to form the sacral crest. And lateral to these, this is called the auricle. Auricle look like the auricle cord or auricular surface to articulate with the ilium at the sacroiliac joint. And this is the hiatus formed by failure of the fusion of the body of the S5 and S4 vertebra. Difference in the sacrum between the male and female include the width of the body of the first sacral vertebra is less than that of the ella in the female and wider in male. The articular surface of the S1 joint occupy 2 vertebrae in the female and 2.5 vertebrae in the male. The anterior surface of the female sacrum is flat superiorly and curved forward inferiorly, whereas that of the male is uniformly concave. The sacroiliac joint, as we mentioned, it is formed between the auricular surface. This is the auricular surface of the sacrum. This is a sacral bone, a triangular. This is the ella on each side. This is the auricular surface. This is the 4 pair of foramina. So between the auricular surface and iliac, this is the ilium, form the sacroiliac joint. This is the left sacroiliac joint, and this is the 4 foramina that it transmit anteriorly the sacral anterior primary rami, and posteriorly it transmit the sacral posterior primary rami. And this is more inferiorly the coccygeus formed by fusion of the 4 vertebrae to form a small triangular bone. Radiographic of the sacrococcygeal region. This is the sacrum. This is the sacral bone, and this is the sacroiliac joint, the left sacroiliac joint, and this is the apex. we talk about the vertebral transition. The vertebral transition occurs between the cervico-occipital region and in the thoracolumbar region and in the lumbosacral region. Usually in the lumbosacral region, we have a lumbarization and the sacralization. The sacralization is the most important one, and it is the most common. In case of sacralization, this is the case of the sacralization, the upper sacral vertebra separated from the sacral bone, as you see with their transverse process. It is separated from the remainder of the sacral bone. While the lumbarization, the L5 vertebra seen fused partially or completely with the sacrum. This is AB view and this is the lateral view. It is not separated from the sacrum, so it is fused with it and called lumbarization. Finally, the ligament of vertebral column. Radiological feature of the ligament. We have anterior longitudinal ligament. This is the anterior longitudinal ligament. This is the vertebral body. This is the anterior border of the vertebral body. So the line that joining the anterior border of the vertebral body called the anterior longitudinal ligament. It is extended from the base of the occiput to the sacrum. It is firmly attached to the intervertebral disc, and this is another ligament that is called the posterior longitudinal ligament. This is the posterior border of the vertebral body. It is extended from the C2 vertebra to the sacrum. Above, it is continuous as the tectorial membrane. This is the tectorial membrane, orange color. Another ligament that joining the tip of the spinous process. This is the spinous process. This is the joining the spinous process that it is from the C7. This is called the supraspinatus ligament. This is the green color. Extend from the C7 to the sacrum and continue superly as the nuchal ligament. This is the nuchal ligament extend to external occipital protuberance. Another ligament seen between the joining the lamina that it is called the ligamentum flavum. This is the ligamentum flavum. This is the lamina. The ligamentum flavum, it is usually yellow color and it is the more extended ligament. This is MRI. Show this is the anterior longitudinal ligament, and this is the posterior longitudinal ligament, and this is the supraspinous ligament that it is continuous superly as a nuchal ligament. Any question?
شكرا على الكويز. نختار محمد مهدي.
نعم أستاذ.
Number 1.
Number 1 anterior arch of C1 الأطلس.
اوكي. نور محمد جواد.
نعم أستاذ. دانس number 2.
دانس. نروح على دعاء علاء.
نعم. Number 3 body of C2.
body of C2. حيدر كريم. Number 4.
نعم أستاذ. Number 4 posterior arch of C1.
شو صح ولا C1؟
الأطلس.
الأطلس. محمد فرحان. Number 5.
نعم أستاذ. Number 5 pedicle. Pedicle of C3.
Okay. Number 6 ليندا.
نعم أستاذ. هاي اللامينة.
This is the lamina. خنساء.
نعم أستاذ.
Number 7.
Transverse process.
ولastly دكتور عقيل.
articular facet.
articular facet. مثل ما قالت البوستيريور اللي تكون هي من الأبر والانفيريور من اللور. سعد محمد تكمل. عفوا.
اي نعم استاذ رعد. رقم 1 عمر.
نعم أستاذ. Vertebral Body.
Vertebral Body. رقم 2 شيماء موجودة شيماء؟
اي نعم استاذ. Costa
اثنين.
vertebral joint, the right costa vertebral joint.
جيد. لارا رقم 3.
نعم أستاذ. left rib head.
نعم. رقم 4 زيد.
نعم أستاذ. left rib, this is the neck.
نمبر 5 أحمد خليل.
نعم أستاذ. the transverse process, left transverse process of the thoracic vertebra.
زين. علي حسين نمبر 6.
يعني هو joint شو اسمه شغلات اسمه.
نعم أستاذ. على left transverse process رقم 5 هو الكوستا transverse joint.
صار شوي misinterpretation. اوكي ماكو مشكله.
رقم 5 هو الليفت كوستا ترانسفيرس، ورقم 6 هو الليفت ترانسفيرس بروسيس.
نعم أستاذ.
بس.
هنا متقاربات واحد الصف الثاني.
انتم
بالضبط.
عكستوها بالعكس. عندك بعد شيء؟
دكتورة رشا
هاي شكرا أستاذ.
شو عجب ما خالد